Hello to everybody, my name is Valerie Zimreva, it's Future Time. And today I have a special guest for you with Yona Levy. Hello Yona.
Hi.
Thanks that you find a couple of minutes for us and maybe you can to introduce yourself to our viewers.
Thank you first of all for having me. The name is Yona, I'm CEO of a company called ALVIT PHARMA, a company that established about 6 years ago within the cannabis industry, developing drugs out of cannabis.
Mm-hmm.
The thought behind the company was somewhere along the way, and unfortunately we're not there yet, but somewhere along the way, doctor would not want to prescribe 2 puffs 3 times a day, flowers. They would like products that speak their language, bioavailability, onset time, something that actually had a clinical trial comparing it to something else they know.
Wow, great. Well, and what is your background? How did you come to this industry?
I think that the one thing that brings people into this industry is a personal experience. So I remember growing up, we thought that that cannabis is like regular drug, and the people that goes to smoke behind school are the people are going to turn out to be junkies later. When Obama left office, I think he said that 4 out of 5 junkies started with a doctor prescription for opiatic drugs.
Mm-hmm.
So we were wrong back then. Now, it took me a while to admit it until I was actually had to face the challenge of taking care of both of my parents, and regular drugs weren't exactly helping them. Regular opioid drug wasn't exactly helping them, and thank God we had the ability to get the license and treat them with cannabis. And I realized that in life there are 2 separate things. One is like the quantity, the amount of life that you have, and the other one is the quality, and the quality is not less important than the length of life. And that have helped them a lot, and ever since I'm in the industry.
Wow, it's actually a very interesting history, from your life. How did you come to this? And how long you already to working in?
So it's been 6 years, and I'll share with you an incident that actually got me to understand that what I'm doing in the company in that segment makes a lot of sense. I remember where my dad, he had asthma, he couldn't smoke. So we're looking for different ways of how can we help him consume cannabis without smoking. And one of the ways I remember, we went to the dispensary and they offered him a cookie, a big chocolate chip cookie. Okay,
Mm-hmm.
And my dad loved chocolate chip cookies, so he went, and I remember driving on the way back. We had the music, and he ate the chocolate chip cookies, and we had a lot of fun. We got home and he went to sleep. And an hour later, we tried to wake him up, and he's not waking up. And 2 hours later, we tried to wake him up again. He's sleeping. He's not dead, but he's sleeping, and we can't wake him up.
Wow.
So we called the dispensary and we're like, what did you put in that cookie?
Mm-hmm.
The dispensary sent us to the WhatsApp a picture with a question. How many pieces did he have? The picture was the cookie divided in the back into 9 pieces. And it said each day he should have 1 piece of it.
Oh, wow.
He had all 9 of them. It was 2 days he was sleeping. He woke up later. Thank God, the damage is no damage, in that sense. But it got me to understand that we need better ways to help people consume it if we want, this revolution of cannabis to actually be completed. That's what we do in our company.
Yes, it's actually for the health, for the people. It's not like for some drink, of course, but it's more for the healthy.
Well, you know what? I always say that the lobbyists of our industry are the strongest one in the world.
Mm-hmm.
Okay, they call pain, they call cancer, they call epilepsy. They don't discriminate. They come to men, women, they come to rich, poor, they come to black, white, Jewish, Muslim, atheist, anybody.
Yeah.
And they don't discriminate, and they work all the time. So there's a real need for people in the medicinal world to have a solution that is not necessarily curing, but helping them going through what they're going through.
Mm-hmm.
And cannabis is one of those things. You actually see it when someone comes with pain. You see the pain on their face.
Yeah.
And usually, let's say you want to give somebody antibiotic. So tell them 2-3 days you're going to get better. When you have someone with pain, at the moment you give it to them, a minute or 2 later, you see them relaxing.
Mm-hmm.
Okay, and that's you see the results immediately. And when you see around the world where countries that are taking a slower path into legalizing it, how the people themselves from the bottom pushing and says, look, my kid got epilepsy. This CBD, solution is helping them. Make it legal, because if you don't make it legal, we're going to bring it anyway. We're not preventing from our kid the solution.
Mm-hmm.
So the world is kind of heading into there, and thank God I'm able to be part of this industry to help those people.
What are you think, from your opinion, why the actually medical cannabis is still not legal in a lot of countries, but we have like this kind of medicine, like as you say, antibiotics is also damage our health, and medical cannabis is actually also helping to us. What is from your opinion, why we have this problem?
Would you allow me to make your question harder? Look at America. 72,000 people died last year from the opiatic plea. Okay, there are literally people dying, and the main reason they're dying is because they were looking for a solution for pain. Where if they would have used cannabis, we wouldn't see those numbers, nowhere close to that area. So we're lucky to honestly that in Europe and in Israel, the opiatic, was not prescribed as strong as it was prescribed in America. But there is what to learn from. You see somebody making a mistake, you don't have to do the same mistake. So in that sense, put aside antibiotic, there are people suffering with pain, and when one has pain, they will do everything to get rid of it. Everything.
Mm-hmm.
And, that led to 72,000 dead people last year in America. It could lead to similar or bigger numbers everywhere else. And bringing cannabis into the play might not solve all the problem, but it's not always a solution of like, this is good, this is bad. Sometimes the solution is it better than what we can offer? And that answer, cannabis answers yes.
Yes. And actually, from your opinion, how did you see how long time have to spend until the people and also the governments and this industry will understand that actually the medical cannabis is helping more than also this medicine pharmacies?
Coming from Israel, they're saying if you have two Jews in the room, usually you have three opinions. Okay, we're very good in like having a lot of opinion and fighting about it. I think cannabis was one of those subjects where everybody from right and left says, you know what, we agree. Okay, this is something we need. It is a revolution that's being pushed from the bottom. It is very difficult for a politician to tell a father that have a kid with epilepsy, look, you're not going to get the treatment for your kid. We're not going to vote for him. Okay, if he does that. And you know what, I do believe that politicians, and I know it's kind of strange to say that they're remember that lobbyists that I mentioned before?
Yeah.
They don't discriminate politicians as well. Their family need cannabis as well. They have someone that needs it. Cancer is everywhere. Pain is everywhere. So they realize, they know it's needed, they've seen it before. In my lectures, usually I ask people in the crowd to raise their hand if they know someone that have cancer or pain or anyone else that needs the use of cannabis. And usually you see everybody's hands up over there.
Mm-hmm.
It's something that everybody agree on. There's a process to get there because that's how the world works. But this train left the station.
Oh. And actually that what is your company doing, right?
Yes, so what we do is we understand that right now the need is flowers and oils. So we're going to be open, we're going to grow in the EU at the EU GMP facility this coming next year, roughly 10 to 16 tons of cannabis, which is I think the largest distributor in the EU right now. We're also have a factory that is fully EU GMP for the purpose of products. Extended release, delay release, pills, sublinguals, a variety of product, cosmetics, a lot of other stuff as well. And we think we're just there. We think that Europe is like 5 years behind America and Israel and Canada.
Mm-hmm.
And that gave us an opportunity. We know what's going to happen over the next 5 years. And, there's nothing better.
And what is going to happen?
Well, Europe is more and more going to open up. Like we just saw France not long ago open up, and other countries are opening up. They can't stop it. It's going to keep on coming and growing. If we put numbers in there, Canada last year sold 24 tons. People in Canada sold 24 tons of cannabis last year. That is on 35 million people. And it's keep on growing like this. Europe is 20 times the size of Canada. Canada generated wealth of over $70 billion of capital market over that years. Mm-hmm. Now with the market crashing, it went down a little bit, obviously, but still tens of billions of dollars was created. Europe is 20 times that size.
Mm-hmm.
So we think that there's going to be a segment in the public market of every one of those countries that are opening up for cannabis, for a sector of cannabis, like happened in Israel, like happened in Canada. We think it's going to create a lot of interest. A lot of people are going to want to get involved in this because it's kind of new. It's like when the internet
still
started.
Don't know about this industry, about how it's working. And excuse me, can you please remind the name of your company?
The name of the company is ALVIT PHARMA.
ALVIT PHARMA.
Yes.
So how long ALVIT PHARMA is already start working in the market?
So we're developing product for the last 6 years, and lately we have opened our first facility of growing in Israel under a public entity in Israel called INTELICANNA. We have another 2 IPOs happening over the next 6 months of other entities that we own. And as I said before, the heart is in Malta, supplying the EU with the EU GMP flowers, oils, and products.
You already started working in Malta, right?
So the first facility should be ready about a month and a half from now, and the bigger facility should be ready in another 8 months after.
Wow. Okay, and may I also ask you about your future plans, also about your company? What you see, how you can grow in the next 5 years, also in 2020?
So my hope is, and I know I have a lot on my shoulder, a lot to prove saying this, okay? But growing that size of plants inside the EU have value of tens of millions of euro. I hope that by the end of next year, we'll be able to maybe offer an IPO for our shareholders. And God willing, we think NASDAQ is going to be the next place where everything is happening. We're going to be able to show our facilities. We're going to be able to show that we sold our merchandise, that we have deposits in the bank, and introduce an interesting, a beautiful word to the investors, which we call profits. Okay, so next year, God willing, profits, an IPO on NASDAQ, and great success for the whole industry, not just us.
And actually, as you know, this industry is not very easy. It was like also a couple of years ago. And as from my experience, I know the team is one of the important when you make some business, when you make some company. Maybe you can tell us a couple of words about your team and how many people is working and many partners.
So what we've done is we took, the company was created by 2 sides of people. One side were people that are coming actually from the cannabis industry, specializing in the plants, specializing in the equipment required around it, the environment, the breeding, the strains, everything around that side. And then another side of the company is people coming from the pharma world that would develop already drugs and pharmaceutical, fully FDA-approved drug. And we kind of put them together and we said, we want to get to a solution. So you have on one hand the standard of like creating a pharmaceutical FDA fully approved drug, which is not something we do. That's the same people that do that, and people that are coming from the agro world, knowing exactly what do you need to get, to create the right API for this, and we put them together, and the result is something in the market that is kind of new called pharma grade product. It's a product that is in a pharma grade. It's allowed to be sold, because you registered it still within the EU, so doctors will be able to prescribe it. But it's not a product that is approved by the FDA. It's competing not against the medicine, competing against the flower or the oil that is being sold right now.
Yeah, and actually, as I understand, you have a global company. It's one of the biggest one. You have a based only in Israel or also some other places?
So what we've done is we brought the brain from Israel, meaning we're able to get the right brain, the development of everything happening from Israel. We put the heart of the company in Malta because we believe that if you want to supply to the EU, you have to be in the EU. If you want to supply to Canada, you got to be in Canada. If you supply to America, you got to be in America. So we've done it. So again, the brain from Israel, the heart is sitting in Malta, and now we're spreading our hands around Europe.
Well, actually, what we can to say is only to wish you good luck and success in your business. Thank you for your time, of course, and we hope to see you soon and also see you in the other conferences, and not only this, because actually that's what you are doing also for the people. You are changing the world in some point, because you help us to understand that the health is one of the best, one of the important in our life.
Thank you very much for your time.
Thank you. And thanks for you, our lovely viewers. With you was Valerie Zimereva, and it is Future Time.